Hello, everyone. My name is Stacy Falvey, and I'm the Adult Services Librarian at the Lake City Public Library. Thank you for joining us tonight for our program, The Myths and Facts About CBD with Dr. Soleil Arrieta. Before we get started tonight, though, I do have a few things to just let you know about. First of all, this coming Thursday, we have another Zoom program with a healthcare professional. We hope you tune in this Thursday for Integrative Therapies 101 with Sarah Stinson from Mayo Clinic Red Wing, where she will define and discuss 4 specific therapies to improve your overall well-being. So we hope you tune in, 6:30. The information is available on our website and how to join us. We'd also like to make sure that you keep your mute button on this evening. We want to make sure that we're not distracting our speaker and other attendees for the presentation tonight. While we do plan to hold all questions until the end, you can use the chat feature on your computer. Typically, it's found either at the bottom of your screen or at the top. And you can submit your questions anonymously to, or at least individually, to Dr. Arrieta, and she will answer those questions at the end of our program. If you'd like to request a copy of tonight's PowerPoint, you can send a chat message to me. I'm one of the other options that's in your chat feature, and you can just send me your email address and I'd be happy to forward you a copy of tonight's PowerPoint presentation. Otherwise, if you'd like to just pick up a printed copy at the library, just indicate that in your chat message and I'd be happy to print out a copy and have it ready for you to come pick up in the next couple of days. Finally, just to let you know, we are recording this program tonight, the presentation portion. But to maintain attendee privacy, we are not going to record the question and answer portion. If you'd like to rewatch the program, or if you know of somebody who may be interested in watching the recorded program, I will have this posted to our Lake City Public Library website in the next couple of days. So with that, I'm going to turn it over to Dr. Arrieta.
Perfect. Thank you so much, Stacy. Good evening, everyone. I'm Dr. Arrieta. I am a physician that works down at Gunderson St. Elizabeth's Clinic in Wabasha, Minnesota. I am dual board certified in integrative medicine as well as family medicine. And that's what I do in practice and love. And in my free time, I like to do little lectures on different topics, such as this, for community outreach and patient education. So talking a little bit about the questions you guys might be putting into the chat, because I won't be reading them until the very end, please put as much information about the topic or question that you have, such as if I'm on slide 3 and you say, hey, what is that thing? I won't know what you're talking about unless you put more details, but I'd love to answer as many questions that I can. And this is just a forewarning that this is a basic entry-level lecture about CBD. I'm not really getting into the details about the nitty-gritty and bio information. This is really about what is CBD, how can I, as a patient maybe, or a caregiver, know a little bit more about CBD, its uses, what can I use it for, what are the different types, how should I go about finding one, what is good, what is bad, what can it be used for, etc. So if you are a provider and are looking for really detailed prescription or dosage information, I will not be talking about that. But if you are interested, that's something else I would love to know, is if this goes really well and you'd like a more specific or detailed presentation, we can definitely make that available if you guys want. So I think those are all my housekeeping topics. So let's get started. Tonight we're going to talk about CBD oil 101. So let's begin. Alrighty. So what is CBD? CBD stands for cannabidiol, which is a naturally occurring compound found in the cannabis plant. CBD is just one of hundreds of phytocannabinoids that help the plant with its medicinal purposes that we have been using medicinally well over 4,000 years. And it has been shown that we've actually been using industrial hemp, or at least the Chinese have been using industrial hemp for probably over 10,000 years, which is quite impressive that humans as a species have known that this plant is available to us, that we have lots of different uses for it. We use it for, ropes and making our buildings with, as well as using it as a medicine for different things. And so it's that medicinal use that we're going to dive into. What's nice about the CBD molecule itself is that it is very safe and it is non-addictive. And so people that are looking for treatments for different conditions and medical situations that they might have, such as trouble sleeping or anxiety, might feel comforted knowing I can take this medication and this substance and not feel like I will then always need to take it or become addicted, or will have issues with this later on the road. There are, this is just a small amount of the phytocannabinoids or the terpenes or the chemical compounds found in the industrial hemp and marijuana, basically the plant itself. As you see, we're going to be spending the majority talking about CBD, which is on the lower portion of this circle, which we'll talk a little bit about antibacterial uses and helps with pain, anxiety, helps you go to sleep, helps with seizures, blood sugars, immune system, inflammation, all sorts. But if you take a look at the top part of the circle as well, that just gives you a little bit of information about how the individual terpenes or other phytocannabinoids work as well medicinally, right? So the CBG also helps with sleep. It also helps to stop cancer cell growth, etc. So when we look at them as a large group, we see that not only do they individually have benefits, but when you put them together, it creates this entourage effect, which is they work better together than they even do individually. So it's this enhancing synergistic effect where when you add them all together, they work even better than if you added them separately. So that is the entourage effect, and a key word that you might come across if you start doing some of this CBD oil research. So that gets us into kind of the different types that you might find. So if we put all of the different terpenes and the phytocannabinoids together, you are going to develop a product that is considered full spectrum. So at the top, you're going to see it has the CBD, it has the terpenes, and it has the THC. You can then remove the THC, which then leaves still 99% of the phytocannabinoids that still have fantastic medicinal effects and uses, but it just removes that THC. Or you can just get a CBD isolate, which is only CBD, no THC, and no other terpenes or phytocannabinoids. So you'd still get the medicinal uses, but again, you're losing that entourage effect or the synergistic effect you would get when you use more compounds from the group as you would get with the broad spectrum or full spectrum. However, some people are unable to use the full spectrum. If it is not legal in the state you're in, and we'll talk a little bit about that later on, then full spectrum might not be a good choice for you. If we are also in a situation where you might be drug tested, whether that's for a job, an employee, or a car accident, whatever the situation, the THC might become an issue because when they're drug testing, they tend to test for THC and not necessarily CBD or, CGC or the other terpenes or phytocannabinoids. So that's also an issue we have to think about, and why they make different products in different spectrums. So, and I apologize if you can hear my dog, but he's in the background, so I'm just going to keep talking like no one else can hear him. So both the industrial hemp strain and marijuana strain are from the same family. They're from the cannabis sativa family. And they have grown apart because they've been used for different purposes. When you look at the industrial hemp strain, like I've been mentioned a little bit earlier, has been used for 10,000 years in China for basically its industrial use, right? Making paper and fiber and rope and building products. And now they're using it in making oils and animal feed, etc. The hemp and industrial strain has 0.3% THC or less. And that's really the major difference, because the other strain, the marijuana strain, has been cultivated over years, and it is now, depending on the type you're getting, ranges from 5 to 25% of THC. Now, why does that make a difference? The THC is actually the psychoactive part of the cannabis plant. And what I mean psychoactive is that it tends to get people, quote, high, right? Whether that's a head high, body high, just feeling kind of like you're out of yourself. That's the feeling and situation, the psychoactive component comes from THC. And that is why some employees and employers will look and do drug testing and are testing specifically for THC, not necessarily the CBD and other parts that are used medicinally, but some of the marijuana strains have been cultivated to get higher and higher percentages of this THC to be used. Some people don't want that sensation. They like, I don't like the way it makes me feel. I don't feel like I can, go about my day and do my work. I just want pain relief, etc. And so if we remove that THC part or limit it to 0.3% or less, then we're able to develop a product or a CBD oil from the industrial hemp plant that still gives you your 99.9% effectiveness, but it removes that psychoactive component. So you're able to go about your day, go to work, drive your car, all that good stuff. But why does this work? Why have we been using this for thousands of years? And we're just now beginning to discover why and how. And unfortunately, we don't have a lot of those specific detailed answers yet. But a large component of why it works is because in our body, everyone has an endocannabinoid system. And these receptors and systems are throughout the entire body, and they do different things. Some turn on certain aspects and some turn off, but the entire goal is to remain at homeostasis. And what that means is to maintain a balanced level where everything is working well and you are healthy and you are stable and you're providing a good environment for the rest of your organs and body to work at its optimal level. When something is off and it needs to be turned back down, so let's say you injure yourself, you're going to have inflammation at that site, right? You're going to have a little bit of swelling, maybe a little bit of redness, and your body starts to react and it starts turning things on, and it starts to create pain sensation in the nerve fibers and swelling and pain sensation in the injured tissue, and the blood rushes to the area trying to fix it and clot and create scabs if you're bleeding, etc. If we do not then turn that system off, it becomes a chronic inflammatory process, which we have found is the root cause of a lot of our medical conditions. And that's a whole nother lecture talking about inflammation and pro-inflammatory situations and how we can decrease inflammation. But the endocannabinoid system helps to turn kind of things down and create that homeostasis and that balance back to normal. So the CBD helps the endocannabinoid system that we already have to continue doing its job and working better in the situations that maybe we have chronic pain and chronic inflammation, and our endocannabinoid system is just overworked and it can't do what it used to do maybe a couple of decades ago. The CBD helps to basically turn those receptors on, turn the endocannabinoid system back to its working conditions, helping to minimize pain, decreasing your inflammation, and creating more balance in the body. There's still a lot of research that needs to be done about how CBD interacts with this endocannabinoid system, because even though we have CB1 and 2 receptors in our own endocannabinoid system, what's interesting is CBD that we're getting from the plant, right, this industrial hemp or cannabis, does not directly fit into our own receptors. They do a little bit, and they affect also downstream receptors, and we know they work, we just don't know how or why. And that's what sometimes is frustrating, is that we are getting a lot of information from even our patients, right, that are coming to us and saying, listen, I tried this for my migraines, or I tried this for my chronic pain, and I tried this for X, Y, and Z, and it works. I don't know why it works, but it works. And so we kind of write that down, and we're trying to reverse engineer what is actually happening at the synaptic or nerve level, and even the cellular level, but a lot of that information is lacking. We do know, however, that the studies we have done has been shown that there are numerous benefits, right, to this cannabidiol or the CBD use. And one of the biggest uses we see, and a lot of studies behind it, is as an anticonvulsant or anti-seizure medication. And this is quite impressive for even people that have been on anti-seizure medications and continue to have seizures and are just not well controlled on pharmaceuticals. They will add on the CBD and feel like, hey, this was the missing piece, I'm doing much better. And because of that, the FDA has actually approved, there's one pharmaceutical medication out there for seizures that is basically CBD pharmaceutical grade to help treat seizures, especially in small children. But it also helps reduce nausea and vomiting. And so you might have heard medical marijuana being used for our cancer patients, right, that are going through a lot of chemotherapy and possibly radiation, and it just causes all sorts of pain and nausea and vomiting. They can't eat and they can't go to sleep. They have used medical marijuana to help because it can help decrease that nausea and vomiting. And the reason is actually because of the CBD or the other phytocannabinoids in there. It has also been shown to combat anxiety and depression, inflammation we already talked about. New studies are coming out about the anti-tumor or anti-cancer effects, decreasing tumor sizes, and treating pain is a huge, big one. And it's not only muscular pain, where you might have arthritis pain, which is not only pain, but the joint inflammation, but it also will help neuropathic pain, which is pain from damaged nerves, which is anyone that has it knows it's a different type of pain. And pain medication that might help with muscular or joint issues does not necessarily help with nerve pain. However, CBD has been shown to be beneficial for both. So that's fantastic. And what is also nice is that it is also pet friendly. So if your pets have anxiety, pain, things like that, they have dosed them. They've made little doggy treats, even little tinctures you can add to their food. So it's been safe in a wide range of animals. This is from a 2017 study, and it basically is a list of what I kind of just talked about, but it's an overview of diseases for which CBD is shown to be beneficial. Because the studies into CBD are lacking, and a lot of that is because up until 2018, CBD was a highly controlled substance, and we could not do a lot of studies, medical studies on it. So we are unfortunately very behind in the study into CBD. And so we don't even know the therapeutic doses for a lot of these. And we are still trying to figure out, again, the mechanism of action and why things work. But there have been studies into a lot of these diseases, and you'll see anxiety, depression, cancer on there, inflammation, arthritis, but even diabetes and cardiovascular disease, high blood pressure, etc. is on there. So it is quite promising. This is the FDA approved medication, the only one on the market, and this one is specifically for seizures and two types of epilepsy that tend to be very difficult to treat with other pharmaceutical medications. And so they're having, it seems to be good results with this. I'm hoping, since they already have one on the market, that we will continue doing research and they will continue putting medications like this available as they gear, I guess, different doses and different mechanisms, maybe adding it to different other pharmaceuticals to use and to make it available on the market, but also that way medical insurances will tend to pay for it, because right now they're not paying for any CBD uses. And in the states where medical marijuana is available, you then still have to see a provider and get a prescription that way and get a green card and, you know, all of that stuff. So we're just hoping that it becomes easier and more available in the future. Right now, if you were to go look into CBD products, it is quite daunting, because you're going to walk into a store and say, hey, I want CBD. And they say, perfect, go down to that aisle. And then you're just inundated and you see lotions and you see salves and you see pills and you see dropper bottles. And there's just a lot available. But each one has its role and each one has its use. So if we are looking at a capsule or a gummy or a little candy per se, you are going to swallow that, and it has to go through your digestive system, and then you absorb it, and then it goes into your body and it starts to take effect. That is probably going to be a slower onset compared to a tincture, which is the liquid version that you're going to get like with a dropper, and you can actually put it underneath your tongue. When you put it underneath your tongue, your body absorbs it into the bloodstream immediately through all the small little capillaries underneath your tongue, and it bypasses the digestive system. So it's already going to start working a little bit faster. And it might be a little bit stronger, but you also have the taste, right? So some people don't like the taste. And that's why they have made these gummies and candies and will coat them in sugar, which if we're using CBD to help lower our blood sugar or help with our diabetes or even our blood pressure, the sugar and gummies and candies are not going to help you, but they taste better. And so people are more willing to take those on. If I'm using CBD for the pain and inflammation, and I have pain in my shoulder, I'm probably going to stick to a lotion or a salve, because the CBD is in that and I'm able to apply it topically exactly where I need the pain relief and the inflammation. And then I don't have to worry about the CBD or other components going through the rest of my body or taking its time. I'm able to apply it directly there. They also make different skincare products, because CBD has an antibacterial component, and it's been using, or it has been used, and new studies are coming out with its use of acne medication. So that's really exciting. So it's a more, I guess, natural, plant-based approach to treating acne. There are bath bombs, there are edibles, all sorts of stuff. So going into the store, it tends to be a good idea of thinking about what you're looking for, what's going to help me most, how often do I want to take it, do I mind a taste, all that good stuff going in, because once you're in that aisle, it tends to be overwhelming if we don't know a little bit more information going in the first place. So are you even in a state that you're able to go into a place and say, hey, I want to buy CBD? This map here is from 2019, and it talks about the legality of CBD by state. I did put a little update. March of 2020, the governor passed a bill in South Dakota that made CBD legal and available. So now you're able to walk into your health food store and buy CBD. However, in November, I feel like that was forever ago, but it was like a week ago. I believe there were 4 or 5 states that had CBD marijuana or medical marijuana in different aspects, depending on what state you're on their ballot, and they have passed. So there is, and continues to be, constant updates with the legality of CBD state by state. And the reason is because CBD in the industrial hemp form was made legal federally in 2018. However, each state has their own individual legality loopholes into, well, CBD fits into medical marijuana and you have to be a medical marijuana patient in order to get it. Or somewhere like Colorado, it's like, listen, it's a free-for-all, and you don't have to have a card, and you just have to be of a certain age, and anyone is able to use and buy these medicinal products. So it gets very confusing when you're thinking about federal laws versus state laws and how legal is legal, because there are those kind of confusing situations, but there's also new laws and new votes coming out all the time that are changing your state situation. So just be aware, depending on where you're coming from, which state you're currently living in, if you're choosing to go and buy something from another state, is it even legal technically to bring it back to your home if you live in a different state? So something just to think about. This is the Farm Bill that took effect in 2018. This allowed hemp to be removed from the controlled substance and allowed hemp to be considered an agricultural product, which means that farmers were now able to start farms and growing and cultivating industrial hemp. Because it was now legal in 2018, that also means that the banks were now able to give business loans to these farmers to help them start these businesses, transition into this brand new field, which has then continued to lead the medicinal field basically into this hemp-derived CBD products and this huge jump we've now seen, right, in the last 2 years. This slide talks a little bit about in 2018, the CBD product sales were 390 million. They're projected to be 1.3 billion in 2022. So we see there's massive growth in the hemp industry. And this slide is interesting statistics since that 2018 bill, Farm Bill took effect, and all of these facts are from actually 2019. So since then, legal cannabis has created tons of jobs in the US, and I actually don't know what the pandemic has done for that. So that would be an interesting view once we are able to take a step back and get that information. But because we see that a lot more CBD knowledge is out there and patients are using it for their medical conditions, that 92% of Americans say even marijuana should be legal because should be out there and it should be made available, etc. what is nice is that if you make it legal, and what they're seeing it, especially in states that were maybe more advanced or more progressive, like Colorado, have made millions and billions of dollars just by taxing this. And so they're able to put that money right back into the state, into their infrastructure and education, et cetera. So that's a really nice twist and pro on it too. 14% of Americans use CBD products. Now, that leads me, I guess, back, Stacy, to the beginning, where I had 2 poll questions, and I'm not sure it would be beneficial now, but I wanted to know kind of if you have used CBD, do you actively use it? Have you never used it? You're just gathering information. What is your knowledge on it? All that kind of stuff. And I apologize. I thought that was going to be a great opener, and I totally forgot. I forgot about it. But let's say
do you want me to still throw it up there?
Sure. So if you guys want, this is completely anonymous, and it's just a poll, and it's fun, so we can kind of talk and see where everyone stands on this. And there are 2 questions, and the first one is basically your use. Have you ever used it? And the second question is about your knowledge. And the knowledge part was more for me, just knowing kind of where should I gear this towards. I'm hoping that the majority of you guys are beginners or intermediate, just because that's the information I'm providing tonight. But excellent. And I'll take a couple more seconds. So anyone that's
Okay, I'm not sure if anybody else is going to, so I'll just end the poll.
perfect.
And I think you should be able to see the results.
Oh, very cool. Okay, so the majority of us have not used CBD before, but they're looking into it. And then right behind that is no, never, under CBD. And then yes, but I have used CBD in the past, but no one seems to be a regular CBD user. And the majority of us are beginners looking into CBD, probably just for the first time, or maybe just know the basics. So excellent. Well, that's exciting. Thank you, Stacy. And I'm sorry, guys, I did not do that at the beginning. That might have been more fun and exciting at the beginning, but all righty. That is still on my screen, Stacy. Is it still on yours?
No, it's not on my screen.
No? Okay. I am just going to present around it. So
right, let me. Now is it off?
No, but it's okay. One of these days I'll be an expert at Zoom, but today is not that day. All righty. So we're going to go forward. And when we're talking about CBD, it is important to distinguish between the full spectrum, broad spectrum CBD isolate. And the reason tends to come down to the percentage of THC, or the psychoactive component that you might find in your CBD oil. This was a screenshot from a news report of, and I believe this guy was an Uber driver, and he had been taking CBD oil for his back pain. And he said, listen, this is great. I love it. This is working really well. So he's using it every day. Didn't feel like it affected him at all. And it wasn't making him high, and he wasn't feeling any psychoactive effects. The bottle he was using said no THC, but he took a drug screen urine test because he's a driver for Uber and they required that, and he failed. And they found that he had trace amounts of THC in the CBD oil that he'd been using. And he had no idea because he said, listen, I bought this from the store. It says no THC, but there was also maybe not the best quality or the best testing that had been done for it. So that's kind of a transition to how small little parts and how or where we get our CBD products from can affect our daily lives. So when we are looking at the CBD products and whether or not it's going to show up in a drug test, the only way of actually knowing is knowing for sure what is in my bottle and in my product. And that tends to be from a third party testing whatever is in that bottle. And so let's say I am company A and I make CBD and I say, listen, I only have less than 0.3% THC, so I'm technically a CBD product, and I am broad spectrum, so I don't have the amount of THC you would have in the full broad spectrum, or full spectrum, I'm sorry. But it shouldn't matter and it shouldn't make a difference. And I put that on my label and you buy it. Well, you buy it, but you can really only take my word for what's in the bottle. Instead of company B says, listen, I guarantee you that I have 30 milligrams of CBD and 0.0% of THC. And to back up my claims, I have sent it to Lab X, who I am not affiliated with, and Lab X did all of their testing and sent me the report, and I have proof that this batch that I made has the exact amounts that I say are on the label. So that is a third-party test that some companies are making available. And that's what I really like and what I'm looking for, especially when these trace amounts of THC can be detected, and that can change your entire life, right? Let's say your employer does those drug screens and you do end up failing because the amounts maybe that were supposed to be trace in your CBD oil is not actually trace. The other issue too is that THC is thought to be a fat dissolvable compound, and so it can accumulate in adipose tissue, and so therefore you can actually increase the amount of THC in your body, not necessarily that you're taking the THC all the time, but even the small trace amounts can build up and you could technically pass or fail a drug screen that way. So if we are concerned about any THC in your product, that's when I would make sure, looking at the quality of the product I'm buying, making sure that they have third-party testing. I can see those reports, that I can look at them, but I'm also looking for other things as well. And those things tend to be an organic certification, making sure that it's also extracted with using CO2, because there's different methods. That's the preferred way. So different things that we're kind of looking into. And the reason too is that the people and the companies that are putting these third-party testing and organic certifications and other things out there, it requires a lot more money to make that product. So those products tend to be a little bit more expensive, but it's kind of the same in your vitamin and supplement world, which is you tend to get what you pay for, right? And so that's also an issue is, am I buying something that is of quality, but in a price range that I can still afford? So when we're looking at that high quality CBD, it really makes a difference, because I'd hate for you to buy a CBD bottle because you're really excited to use it. It's going to help you with sleep, but it was $7 for the entire bottle, and it says that there's 100 milligrams of CBD, but there's no THC, but there's no third-party testing. So they could be selling you a bottle full of olive oil, and you unfortunately just paid, however, said $7 or something for this tiny bottle of olive oil that has no medicinal purpose because it doesn't actually have the amounts and the quantity of the CBD that you're looking for. The other thing is the quality is important because it interacts with other things. And so that's, I guess, a little segue is that it's also important to tell your physician and provider if you're choosing to take any of these products, so they can help you determine if any of the other medications that you're on can have side effects or interactions. Because we are still in the early stages of a lot of these testing and medical studies with CBD, a lot of this information, unfortunately, is just unknown. But we have seen that patients that are on blood thinners such as warfarin or Coumadin tend to have complications when the CBD is added. So it tends to cause bleeding issues. And then we have seen some issues if you are taking other seizure medications and you are trying to use CBD to help your seizures, but you're already on seizure medication. That tends to be an issue. So that's why it's important to talk to your physician about it, so you can sit down and say, listen, this might interact with these medications, and because of that, we might lower this dose, or we might increase this one over here because it's just going to make this one not as strong or not as potent. So that's always good to talk to your physician and just let everyone know on your medical team about what you're using, so they can always be aware of those interactions. It's also important quality-wise because the industrial hemp plant in of itself is used to remediate the soil. And so sometimes the soil gets really sick and there's lack of nutrients, and there might be chemicals in there, and there might be heavy metals, etc. The industrial hemp is able to pull out all of those pollutants and stores those toxins in the plant, which then creates an issue if you then absorb or take in the CBD from that plant that now has all those pollutants and heavy metals in it. And so that is why when I'm looking for a product, I'm looking for hopefully certified organic. So we know that the soil that the industrial hemp has been grown in is of good quality. It's not absorbing any of those heavy metals and other toxins that I don't want in my body. So that's something else. And then this is just a slide talking about the different heavy metals, right? So mercury, lead, cadmium, all of those really gross stuff you don't want to be ingesting. And if you don't have to, because you can get a quality product from a place that can guarantee it doesn't have any heavy metals, and that's why it's good for the third-party testing as well, then that's gonna point you in the right direction. So thank you guys so much for coming. These are a little of the studies that are out there. These can all be found on PubMed and the National Library of Medicine, and it talks a little bit about what we discussed today, right? A little bit of anxiety and depression and pain and inflammation. So that's out there as well. I will take this time to look at the chat view to see if you guys have any questions, but I also wanted to let you guys know that you can find me. I do take consultations for integrative medicine, which is the subspecialty that I practice over at Gunderson St. Elizabeth's Clinic in Wabasha, and the clinic phone number is right there listed. So I'll leave that up and we'll start looking at the questions if we can.
And at this point, I'll stop the recording